Okay, we are back for part 2 of the MCQs for anti-cancer drugs, hormone drugs, antimicrobials, and CV drugs. So remember that methotrexate is B, a folic acid antagonist. Okay, moving on, number 28. Anti-cancer drug of plant origin. A, dactinomycin, B, vincristine, C, methotrexate, and D, procarbazine. And the answer is B, vincristine. Moving on, number 26. Which of the group of hormonal drugs used for cancer treatment is used for cancer treatment? The A, mineral corticoids and glucocorticoids, B, glucocorticoids and gonadal hormones, C, gonadal hormones and somatotropin, or D, insulin. And the answer is B, glucocorticoids and gonadal hormones are the group of hormonal drugs used for cancer treatment. So remember, it's glucocorticoids and gonadal hormones, not the mineral corticoids. 22. All of the following effects are disadvantages of anti-cancer drugs except A, low selectivity to cancer cells, B, depression of bone marrow, C, depression of angiogenesis, and D, depression of the immune system. And the answer is C, depression of angiogenesis. Next one. What is the most likely adverse response as a result of vincristine? A, nephrotoxicity, renal damage, failure. B, neutropenia. C, peripheral sensory and motor neuropathy. And D, pulmonary damage. If you remember the chemotox man from first aid, you would know that in the shape of V are the arms and the legs. And so you could remember that it would be C, peripheral sensory and motor neuropathy. Hormones are A, products of endocrine gland secretion, B, mediators of inflammatory process, C, byproducts of tissue metabolism, D, product of exocrine gland secretion. The answer is A, hormones are products of endocrine gland secretion. Easy one. The others will try to confuse you. Next one, the posterior pituitary does not secrete A, vasopressin, B, oxytocin, C, growth hormone, D, all of the above. So the answer is C, growth hormone. That is the anterior pituitary gland. 19. Indications for vasopressin are which of the following? A, diabetes mellitus, B, hypertension, C, pituitary diabetes insipidus, D, incompleted abortion. So the answer is C, pituitary diabetes insipidus is the indication for vasopressin. You might also think of bedwetting as one example where vasopressin can be used. ADH. Next one. Vasopressin possesses the following. It is A, antidiuretic property, B, vasodilation property, C, release of thyroid hormone into the plasma, and D, diuretic property. The answer is C, release of thyroid hormone into the plasma. So that's what vasopressin does. Next one. Thyroid stimulating hormone regulates the following. A, iodine uptake, B, biosynthesis of iodothyroglobulin, C, release of thyroid hormone into the plasma, D, all of the above. And the answer is D, all of the above. It does all of these things. TSH. TSH is in the anterior pituitary gland. 28. Synthesis and release of thyroid hormones are controlled by A. Anterior pituitary alone. B. Hypothalamus alone. C. Blood levels of thyroid hormones alone. D. All of the above. And the answer is D. All of the above. For synthesis and release of thyroid hormones. They are controlled by all of these. Anterior pituitary, hypothalamus, blood levels of thyroid hormone. (32) Common side effect of thyroid hormones is the following. A. Increase in basal metabolic rate. B. Angina pectoris. C. Tremors. And D. Exophthalmos. And the answer is D. Exophthalmos. When you think of the thyroid hormone and hyperthyroidism, you think of the eyes that are bulging out. That's exophthalmos. Which of the following is true for glucagon? Glucagon, A. Stimulates gluconeogenesis in the liver. B. Stimulates the secretion of insulin by beta cells. C. Inhibits glucose utilization by skeletal muscle. And D. Inhibits uptake of amino acids by cells. So what does glucagon do? The answer is A. It stimulates gluconeogenesis in the liver. (7) Insulin cannot be administered by A. Oral route. B. Intravenous. C. Subcutaneous. D. Intramuscular. A. Cannot give insulin by mouth. 11. Diabetic coma, ketoacidosis, is treated by administration of what? Either A. Lente insulin, B. Glucose, C. Crystalline insulin, or D. Oral anti-diabetic drugs. And the answer is C. Crystalline insulin. 22. The action of insulin is potentiated by sulfonylureas. B. Glucagon. C. Biguanides. D. None of the above. The answer is C. Biguanides. The action of insulin is potentiated, strengthened by the biguanides. What do the sulfonylureas do? They cause the beta cells, insulin beta cells, to secrete more insulin. Next one. Michael is being treated for ongoing cardiac problem. He is currently taking 6 flecainide tabs a day using the Vaughan Williams classification. This is an example of a class 1 drug, B. class 2 drug, C. class 3 drug, D. class 4 drug, E. unclassified drug. The answer is A. class 1 drug. Okay, let's take a break there and we'll come back in a sec.